Hi, welcome back to Ahead of the Curve. This is episode 15. And today we have a special guest with us. Her name is Macy Guisto, and she's a physical therapist over in Pittsburgh, Pennsylvania. She is actually working at one of my really good friends' clinics called Wonsettler PT, and she specializes in chronic pain. So we're really excited to have you, Macy. Welcome.
Thank you so much for having me, Megan. This is such an honor to get to chat with your community and with you about some really exciting topics.
Thank you so much for taking your time out of your Saturday. I have my coffee here. I'm just like trying to warm up. It's probably cold where you're at.
Yes, it's been very cold.
Yeah, it's been cold here in South Carolina. I keep thinking about my family and friends up there, and I'm like, holy smokes.
Time to get out the winter jacket.
Yeah. So really excited to have you on. I've had a lot of people also excited, my clients and some of my followers on Instagram. They're really interested in this topic because a lot of them have been dealing with pain for a long period of time. And it's something that is very nuanced. I'm reading a book about chronic pain right now. It's called The Way Out. And it's been really eye-opening for me to see the changes that actually physically happen in the brain when someone's been experiencing pain for a long time. So I just can't wait to get your perspective on things and just hear your feedback and insight on this. So can you just start off by telling us a little bit about what got you interested in working with chronic pain to begin with?
Absolutely. So, the biggest thing I've noticed as I started practicing as a physical therapist is a lot of patients coming into the clinic who are almost at the end of their rope. They've been struggling with persistent pain for so long that they don't really know where else to turn to. They're kind of cornered. They've tried all of these treatments, and you can even see it on their face. They're so kind of defeated by this. And it really kind of broke my heart to see people at the end of the rope like this. And I said, I'm in the perfect position to help and make a huge, remarkable change. With these people who come into the clinic, I kind of see the biggest untapped potential. And that's what makes me so excited. I have seen patients who had had pain for years go from coming in the first day of their initial evaluation being in tears, barely able to stand for more than a few minutes, to at the end of a couple of months of therapy, learning about pain, learning how to move their body, being able to go to Scotland and hike a mountain, go paddle boarding, pick up their 3-year-old son off the ground again, or even do high intensity exercise. Seeing that huge, remarkable change that I can help someone walk through is something I really can't put into words and that I just love doing for people.
It's amazing. It really is. I've definitely experienced that myself working with people with scoliosis. It's very defeating, and you see practitioner after practitioner, medical provider who just kind of wants to give you medication, or you have the option of surgery. There's like so few options. So when you find that there's some hope, it's just completely life-changing for those people. So can you tell us a little bit about the certification the training that you've gone through to work with chronic pain?
Yeah, absolutely. It is a 6-month program. I'm about over a third of the way done with it. It's through Evidence in Motion, which partners with Purdue University. And it's being taught all online by really two of the big names in pain neuroscience. So Dr. Adrian Lowe and Dr. Louis Pontadora. And it is amazing. I am learning so much, trying to put it right into action in the clinic as I learn throughout the week with my patients. And I'm already seeing a really large impact. I'm learning how to educate a little bit better about pain, and then getting people to move a little bit more easily and really set some clear defined goals about who do I want to be outside of my pain, which is so key.
Yeah, it is. Yeah. When you've been in pain for such a long time, it becomes part of your identity, and it just kind of delineating yourself from that is so important, but it's hard to do. It's hard to know how to do that and help people, guide people to that. Can you tell us a little bit why chronic pain occurs?
Yes, this is such a great question. And I wanted to start out by chatting a little bit about how remarkable it is, but how simple of a thing that it is to do to explain to someone what pain is. I typically will start out with my patients on initial evaluation day and just ask them, has anyone described what pain is to you? And my jaw kind of hits the floor because most people say no. And they're really kind of taken aback a little bit by the question. And I'm like, wow, you've struggled with discomfort for years and years, and no one ever sat down and talked to you about it, right? I'm sure you have this in your scolio population as well. And no one really sat down and talked to them about it, which is so powerful, right?
Right. Hmm.
And in this patient population, I will sit down with them and tell them a little bit of a story. I think it's easier to digest that way. So I'm going to tell you guys this story. So I will tell them, let's imagine we're walking along the road and we step on a nail. That nail goes into our foot, and of course, we experience pain. But how does that occur? It's very simple. We all know that happens. What happens is the nerves around the foot will shoot an impulse to the spinal cord, then to the brain, and an alarm will go off. Ding, 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 ding. Hey, Macy, there's a nail in your left foot, right? And we experience pain. We all know that to be true. So, what are the next steps? What happens after that in our body and externally, kind of as we walk through life after we get that nail in our foot? So, we go to the emergency room, of course, they remove the nail, they clean out the wound, and they stitch it up, right? So, the pain doesn't go away right away, though. And this is interesting and something a lot of people don't take the time to reflect on, but something really important. So over time, that alarm system that let us know, hey, there's a nail in your foot, there's danger, it goes down over time. So the pain might be a 10 out of 10 the first week, and then it'll decrease over time until we're all healed maybe a month later and it's back down to a 0, and that alarm is calm and happy again, right?
Hmm.
There's nothing to alert us. But what happens in those people who the pain doesn't go back down to a 0? That's the key question, right? And we know that about 1 in 4 people, which is a huge number, um, the alarm system will stay in this hypersensitive mode. So it switches and it goes into hypervigilance. And we're trying to kind of watch out for anything that might even come in close contact with that foot. And we get a huge pain impulse because the brain wants to protect that foot.
Hmm.
Now, a huge question patients ask me is, well, what makes that switch flip for me particularly? And you see that frustration in their expression, like, why me? Why does this happen to me? So usually what happens is there's many contributing factors that make that switch go to hypersensitive mode. So things like having a traumatic event be the cause of your injury. And that can be emotionally traumatic or physically traumatic too, either one or both, right? And things like stressors, worrying about, am I going to be able to get back to work with this diagnosis or this injury? Financials with work as well, or the strain it might put on relationships. All of those things build up to pushing that alarm system to remain hypersensitive over time.
Hmm. Yeah, that's a really great answer and story, very great depiction of things. And I often wonder that myself. It's like, why do some people recover fully from the pain and they don't struggle with that persistent hypersensitivity to pain? But that makes a lot of sense. Um, like I mentioned earlier, I'm reading that book, The Way Out, and it talks mostly about pain reprocessing therapy. And I know that it's probably really involved, but if you could kind of summarize a few points of the pain reprocessing therapy, like how does that work? What does it look like? It'd be great.
Great question. So I'm going to kind of just summarize pain reprocessing therapy. I'll refer to it as PRT for short. Um, it is essentially getting your nervous system, your brain, and the 45 miles of nerves we have throughout our body to unlearn pain, right? I describe pain as almost a learned habit, right? Just like we all learned when we turned 16, we learned how to drive, right? And now we've all been driving probably for years, if you're listening to this podcast, hopefully, maybe not. Um, so we learn when we're first getting in the car to drive, we're like, oh my goodness, where is, the windshield wipers on and off? Where is the turn signal? Where are my high beams, my low beams? And you're thinking so heavily about it every time when you're initially learning. But then over time, every time you practice that skill, our neural pathways in our brain get really strong. And now you can probably hop in the car and go on a 2-hour trip and not even think about any of those things, right? We go in autopilot. The same thing happens when we learn pain. Our brain goes in autopilot into that really learned strong pathway of pain. So pain reprocessing therapy is taking those really strong pain pathways and breaking them up, forcing us to unlearn our pain patterns. So there's 5 steps that they say are included in PRT. So the first one is basically what we chatted about earlier, just learning about what is really simple, really basic, teaching patients, okay, this is how we process pain. And then this is the tough step, teaching them that pain is reversible. A lot of people have had it for so long that they are really having a tough time being convinced that it can be reversible, it can be managed, and you can have kind of power back over your pain. And then the third one is kind of teaching someone that pain doesn't always equal harm or injury. Again, a challenging one. My mantra in the clinic is sore but safe, right? You're sore because you did some really good work, but we're in a safe zone, right? We're respecting our nervous system where it's at, but we're pushing our limits little by little. And then the fourth step is kind of processing all of the emotional overload that we're having. And I'm glad we're going to talk about that a little bit later, how to process stressors and emotions in life, because that's huge. And then the last step is drawing our focus away from the negative sensations in our bodies and emotions, and then pushing more towards the positive sensory and emotion things that we're processing.
Amazing. Yeah. It was cool hearing you explain just those pathways that have built up, the really strong pathways with pain. It's a very similar experience with my patients learning their posture corrections. So initially, they're having to think about every single step of where are my feet, where are my hips, where's my weight placed, and it just feels like it's bananas. It's completely overwhelming. But, kind of like you said, with repetition and with time and practice, those pathways become so much stronger that it just becomes second nature. It's just very simple for them to, oh, okay. They don't even realize it, that they're shifting their weight into the correct position, and then they find their alignment. So it was neat to hear you explain that. And it's so similar. So
Absolutely. I love that application to that specific, scolio patient population, because that is so true. It's more of an awareness, right? We're bringing awareness and then training our body into those new patterns, which is really challenging. And, what you and I do every day is coach people through that process. But then it's so cool to see, the end outcome and what people can really do.
yeah. Yeah. So a lot of times with scoliosis, we become very tied to our diagnosis, also to our Cobb angle. It becomes part of our identity. And why would you say is it important for people with scoliosis to have another identity outside of their diagnosis, outside of that Cobb angle? And then how does somebody go about doing it?
This is such a good question, like I touched on earlier. I think it is one of the first things I really want to, talk to a lot of my patients with about kind of who are you and what are your goals? What are your values? What is, the essence of you? Because that's really what the human experience is about. Who are you and what do you, see yourself as? So
Mm.
it's really, really tough for our brain and our nervous system to be able to allow for emotional and physical healing. If that pathway I was telling you about in pain or even in discomfort, if that's so strongly married to the self or our identity, it is so tough to allow for healing. So that's kind of the first step. You want to be able to divorce those two things,
Mhm.
right? I have this, but I am this other person, right? I have it, but I'm not that.
Yeah.
So I will take patients through this exercise, but Megan, I want to get your take on this too, because I think it's so cool and everyone kind of has a different approach. So I will tell patients to do this exercise. And this is usually, down the road once I've gotten to know them a little bit, because this is a tough exercise to go through. So I'll tell someone, pull out a pen and paper, and I want you to make two columns. So the first column on the left is going to be everything that you identify in life as a role for you, right? For me, it might be physical therapist, caretaker, fiance, sister, daughter, aunt, all those things, right? Those are all the things that I am in life. And you could see I can't help but smile when I think about those things, especially being an aunt. And that's usually really easy for people, right? They'll take through these roles and write a lot of things down. It's pretty cool. Then we go to the column on the right. This is the challenging column for people. And it's okay if you only can come up with one or two things, but I usually set a goal of coming up with three things that are the essence of you, things that you really love about yourself, right? And for mine, I would probably write down kind, compassion, and bubbly, right? Those are three things that I feel like are the essence of me that I really like about myself. And that's really hard for some people. And they maybe have never even been posed with that question, and that's okay. But give them some time to think about it and kind of chew on that. Um, and then I want you to step back, and this is really powerful. Look at that list. Did you see scoliosis on that list? Did
Hmm.
you see pain on that list? Did you see whatever medical thing that you have going on? Did you see any of that on that list? No, that's not who you are, right?
Mhm.
And sometimes it takes that kind of concrete piece for people to really say, wow, that's not who I am, right? And it
Mhm.
might not take the first exercise, but just chatting with people and really getting them to try and come to that conclusion can be really powerful. But
Yeah.
Megan, do you have any techniques that you like to use with people?
Um, so I do have a hard time with that because I feel that it is really hard to divorce yourself from your diagnosis. And also for me personally, I've kind of turned, my diagnosis of scoliosis into I like to say a superpower because I can relate to my clients so well because I have it myself. But I think that what we're going to be talking about next is one of the main things that I use is goal setting. So having people look ahead to things that they're looking forward to doing. So like dancing at their child's wedding or um, running in a race, things like that, that helps to just show them what they're capable of, or, give them something to look forward to that doesn't really have to do with their condition. So, but I think that, that exercise that you just described is very powerful. So thank you for sharing that.
Absolutely.
Yeah.
Absolutely. And I agree with you. I think in my certification, my pain certification, that's one of the huge pillars of treatment. Really for any chronic or lasting condition, you have to identify those goals because they can help you almost like look into your crystal ball. Like, who do I want to be? I want to be a person that can run a 5K, or I want to be a person that can go on walks with my grandkids, or I want to be a person that does Pilates, right? So it's
Yeah.
very powerful.
Yeah. So important. So important. What are some tips for managing life stressors and emotion surrounding scoliosis? What would you suggest for that?
Absolutely. And that's such a great point. I think this can apply to the patient population that working through scoliosis and treatment with you, as well as really anyone in just daily life. I try and integrate this and, my everyday routine because stress is normal part of life, but over stress and chronic stress is not something that we should be dealing with and that we should have management strategies with. So it's definitely really important to come up with a plan and prioritize a couple of these things because there's a lot of different ways that we can do that. It's just finding what works for you and what you can kind of maintain consistently. So the first thing that I usually will tell people, especially I think in the scolio population, this is probably true. Find a really good support system, right? Whether that's your family, your loved ones, maybe like a scolio support group or, some people that you work with kind of in that community. And, let them know what you're going through, what your treatment is. And, if making a game plan of, if I have a flare up, what are things that my loved ones or my support group can do to help me through that time period, right? It's kind of like building yourself a trap door. I usually tell my patients, right? We don't like to feel trapped, but if we have a plan for potentially when we have a flare up, we're going to feel less trapped and like we have some help along the way. So that's the first thing. The second thing I like to tell people, and I'm sure you do too, is move your body, right? Got to get moving. That'll
Absolutely.
Yep. That'll release those nice endorphins and help us feel good, right? And every day that might look a little different. It might be, hey, today I can just go for a walk. Today I'm just going to do my corrective exercises, or today I'm just going to do a yoga flow. And that's totally okay. But motion is lotion. We want to get moving, release those feel good hormones in our body, right?
Mhm.
Another thing is sleep is huge, huge, huge. And I know we're going to get into that a little bit later, but sleep is almost one of those things that if you can get that right, your life is going to be remarkably different. It's almost like setting a reset button on your brain and your nervous system so that you're ready for the next day to kind of take on whatever is coming at you. And then also just practicing mindfulness and meditation, kind of deep breathing, bringing yourself to the current moment and kind of what are the things that are in my control that I can kind of tackle and trying to let go a little bit of the things that are out of your control. So those are kind of my stress management tools.
I love those. I love those, especially the movement. As far as sleep goes, with my clients, I have like a couple of things that I suggest that they do before sleeping, especially if they've wound up a lot of rotation in their body throughout the day. Like if they're a ballet dancer or a gymnast or, somebody that is a yoga instructor who, you have to, go through those movements that have rotation. Um, and it just kind of creates these rotational energies in your tissue. So I have them do some elongations before bed to kind of hit the reset before you hit the big reset when you're sleeping. Um, but what are some sleep hygiene ideas or suggestions that you have, and why is it important for managing chronic pain?
Absolutely. So, sleep is one of those things that I think a lot of people kind of regard as I've never been a good sleeper, or sleep is what it is. And it's just a thing I kind of deal with. And I try and get someone's mindset to say, okay, if you can do a couple of things to make your sleep a little bit more restorative for not only your physical body, but also your nervous system and your brain, you're going to feel like you have a lot more energy to put towards the things that you love every day and the things that you have to do every day. So I have a list of, I think there's about 10 to 12 items on it that I print out in the clinic, and I will present it to someone and I say, all right, take some time, look through this list. We'll go through a couple of things on there. And then I say, I want you to pick 1 or 2 things that you're going to try and implement this week to make your sleep better. I think that a sleep routine can be really overwhelming for someone if they're trying to add too many things at once. So picking 1 or 2 things and say, hey, I'm going to really kind of get good at these and see how it goes from there. So some of my favorites are setting a bedtime every night. And that might change on the weekdays versus the weekends, and that's okay. Turning off the television, getting away from your phone at least 30 minutes before bed, right? Pull out a book instead, or talk to your significant other, talk to your kiddos. Do something that lets your brain and your nervous system switch off from being so on all day and getting geared down for sleep. Also, exactly like you said, a little mobility flow or some corrective exercises could be really, really beneficial. And deep breathing, that kind of helps us go from a really high state in our nervous system down to what we call rest and digest, right? We're ready for that sleep, ready to be restored. Is there anything else, Megan, that you like to tell your patients to do before bed?
Those are probably some of the same things that I suggest as well. Especially turning off electronics, and I know how hard that can be. Even like maybe you're on board with that, but your partner isn't, or your spouse.
Right.
My husband loves to fall asleep with the TV on, and I like to like read and have it off. So it can be a little challenging to, figure that out. But yeah.
Absolutely.
Those are all really good suggestions. Yeah, so I've loved this conversation. I feel like there's just so many good takeaways from it. And I think that this will be an episode that people will probably return to a few times and take notes. And just there's some really good applicable things that people can implement into their life right away. So hopefully we can have you on again and have more conversation about this, because it's such an important topic, and it really does help to change people's lives. It's profound. Macy, how what would it look like for somebody that would want to work with you? In what capacity could they do that? Just share that a little bit for us.
Absolutely. So if you want to work with me for one-on-one pain coaching, you can either go to my Instagram and direct message me at Pain Coach Macy, or alternatively, you can also shoot me an email. My email is Macy, MACY, Guisto, GUISTO @gmail.com. Either one would be great. I'd love to connect with you and kind of work through some of these things one-on-one to try and get you on a really good path to healing. Or if you want to work with me for physical therapy, I do telehealth or in-person visits. You can visit Wonsettlerpt.com. And thank you again so much, Megan, for having me. I really enjoyed kind of getting to chat with you and reaching out to the scolio population. It was really fun.
Thank you again. I'll see you soon.
See you soon.